This presentation will provide you with a better understanding of the Laurel County Health in Motion Coalition and its work in completing a community health assessment utilizing the MAPP framework. The presentation provides an overview of the MAPP framework as well as the local public health system and 10 essential public health services. This is a great presentation for new members of the coalition and can serve as a good refresher for seasoned members of the coalition. The coalition was put into place in 2012 as a result of a partnership between the Laurel County Health Department and St. Joseph London. The two partners had a goal of completing a community health assessment for Laurel County. The partners wanted this assessment to be a county-level assessment that utilized all agencies involved in the local public health system. The coalition met monthly during the months of 2012 to develop the first ever Laurel County Community Health Needs Assessment. As a result of that assessment, the first Community Health Improvement Plan was completed in 2013. As a result of branding the coalition, the name Laurel County Health in Motion was decided upon in 2015, and the coalition has that name today. The goal of the coalition remains to provide a comprehensive and unbiased health profile of Laurel County by completing the Mobilizing for Action through Planning and Partnerships, otherwise referred to as MAPP, model, with partnerships among multiple agencies across the community. Laurel County's vision for a healthier community promotes participation of community partners and its residents engaging in willful cooperation to improve the safety and well-being, health, knowledge, and access to resources toward the level of a healthy community. MAPP stands for Mobilizing for Action through Planning and Partnerships. This framework is centered around engaging the community in the community assessment process. You also take action by implementing a health improvement plan. You plan by applying strategic planning concepts to the process, and you involve local public health system and community partners with the understanding that the public's health is more than the concern of the health department and that every partner within the community plays a role. MAPP is a community-wide strategic planning tool for improving health and safety within each community. It's a method to help communities prioritize public health issues, identify resources for addressing them, and take action. It provides a way to organize, integrate, and align activities that may already be going on in your community. Many times it's asked, what value does my community get from completing this process? Well, the process allows us to gather information about citizen attitudes and opinions regarding issues, problems, and opportunities that are important to them. The process also allows us to determine how citizens rank issues, problems, and opportunities in order of importance or urgency. It gives citizens a voice in helping determine the priorities that the coalition or body of work focuses on. It also allows us to evaluate any current programs and policies that we already have in place in the community in order to effectively improve and carry out those current programs and policies. So I want to share a definition of public health. Public health is not just the health department. Public health is a shared responsibility, not only of healthcare providers in the community and public health officials in the community, but also a variety of other actors in the community who contribute to physical, emotional, and social well-being of individuals and populations. You may have heard the term public health system. So what exactly is a public health system? They're commonly defined as all public, private, and voluntary entities that contribute to the delivery of essential public health services within a jurisdiction. They can also be described as a network of entities with differing roles, relationships, and interactions as depicted in the picture on the next slide. All of these entities contribute to the public's health and well-being throughout the community. The governmental public health department is a major player in public health, but they do not provide the full spectrum of essential public health services alone, and they often require collaborations with other public health partners. So as we said, there are multiple agencies and organizations within the community that make up the local public health system. So what is your role or your agency's role within this system in Laurel County? At the center of the local public health system is typically your public health agency. As we said, your local health department usually depends on those collaborations with other agencies to carry out the 10 essential public health services, because the local health department does not have the capacity alone to carry those out. Also, members of the local public health system include our healthcare providers, like our hospitals, physicians, community health centers, mental health, labs, and long-term care nursing homes. Also, our public safety organizations like our police, our fire, and our emergency medical services. Human service and charity organizations are also part of the local public health system. So things like our food banks, our public assistance agencies, and transportation providers, as well as our educational and youth development organizations like schools, your faith-based institutions, any youth centers, or other groups that assist with informing, educating, and preparing our children in the community. We can also consider recreational and arts-related organizations members of the local public health system. Why? Because they contribute to the physical and mental well-being of the community and those who live, work, and play in it. Our economic and philanthropic organizations, like our employers, our community development organizations, any zoning boards that we have, our community and business foundations, they provide resources necessary for the individuals and organizations to survive and thrive within our community. And finally, our environmental agencies or organizations. They may enforce laws related to or advocate for a healthy environment. So hopefully you're able to see where your agency falls within the public health system. So this is a graphic that we use to depict the local public health system. We refer to this as a jelly bean chart. So you can see the public health agency in the community is often at the center of this local public health system. But there are lots of other agencies and organizations that are there that are intertwined. And you can see every single agency is connected in some way to the local public health agency. And this is because the local public health agency needs these partners to ensure that those 10 essential public health services are carried out in the community. And without these other partners, there would be no way that we could effectively and efficiently carry out those services and make our community as healthy as possible. The 10 essential public health services describe the public health activities that all communities should undertake. For the past 25 years, the essential public health services have served as a well-recognized framework for carrying out the mission of public health. This framework was originally released in 1994. You can see the original infographic for the framework on the left side of the slide. It was more recently updated in 2020, as you can see in the infographic on the right side of the slide. The 10 essential public health services provide a framework for public health to protect and promote the health of all people in all communities. As you can see, there is a difference in the two infographics. In the 1994 version of the essential public health services, research and system management was at the center of all of the services that were provided. However, in the revised version from 2020, those were replaced by equity. To achieve equity, the essential public health services actively promote policies, systems, and overall community conditions that enable optimal health for all and seek to remove systemic and structural barriers that have resulted in health inequities. Such barriers include poverty, racism, gender discrimination, ableism, and other forms of oppression. Everyone should have a fair and just opportunity to achieve optimal health and well-being, as the new 10 Essential Public Health Services define. This is MAPP's illustrated community roadmap. It depicts the process communities undertake when completing the MAPP framework. To organize the MAPP process, lead organizations in the community begin by organizing themselves, recruiting participants, and preparing to implement MAPP. The second phase of the MAPP process is visioning. A shared vision and common value provides a framework for pursuing long-range community goals. The 4 MAPP assessments provide critical insights into challenges and opportunities throughout the community. We will discuss these in more detail a little later in the presentation. Using the results of the assessments, participants identify strategic issues and then formulate goals and strategies for addressing each issue. This information is crucial for the action cycle, during which the participants plan for action, implement, and evaluate. Conducting MAPP should create a sustained community initiative that ultimately leads to a community health improvement. This is another depiction of the process of completing the MAPP framework. This visual shows that MAPP is a cycle. Public health departments are required to complete a new cycle at least every 5 years. Nonprofit hospitals are required to complete a new cycle at least every 3 years through the community benefit. Our coalition wanted to maintain the strong partnerships we have with St. Joseph London, so it was decided that Laurel County would complete a new cycle every 3 years. The illustration also emphasizes the importance of continuous planning, implementation, and evaluation of progress toward the community's health priorities and how the 4 assessments are key to the overall process. As mentioned in the earlier slide depicting the 10 Essential Public Health Services, health equity should be at the center of everything that the local public health system does. Dr. Adewale Troutman says that health equity is the realization by all people of the highest attainable level of health. Achieving health equity requires valuing all individuals and populations equally and entails focused and ongoing societal efforts to address avoidable inequalities by ensuring the conditions for optimal health for all groups. So what are some ways that we can ensure that we're addressing health equity during the implementation of the MAPP framework, when completing our community health assessment and developing our community health improvement plan? Some of the things that we can do is mobilize the right people and engage individuals and groups that are committed to health equity right from the beginning. We can also measure health equity during the community health status assessment, and we'll talk a little bit more about this a little bit later when we get to the slide that specifically discusses this assessment. We can reflect on health disparities and health inequity data from the community themes and strengths assessment. We can include people who have experienced health inequities in our conversations, for example, with our focus groups. So we'll talk a little bit more about that as we get into the community themes and strengths assessment. We can also include health equity in questions during the local public health system assessment. This is when we will assess how well our partners think that our community as a whole is carrying out the 10 Essential Public Health Services. We can also steer toward questions with the health equity focus or lens when we start to identify strategic issues and identify potential solutions for those issues. So MAPP is the framework that we use. So it tells us how to conduct the process. But another tool that we find very valuable in the work that we do as a coalition is the county health rankings. Many of you are probably familiar with the county health rankings. They are released every year in the spring, and they help us to see where our community falls on different health factors and health outcomes. So it is a model that provides a snapshot of a community's health and a starting point for investigating and discussing ways to improve health. That's why this county health rankings is a great tool for our coalition, because it's a good starting point to help us as we move forward in doing this assessment. So our coalition, the Laurel County Health in Motion Coalition, utilizes this model to help us better understand the health problems that have been identified in our community by the data that's already out there. It helps us to mobilize action to improve community health. So we bring all of that to the table and we work as a group collectively to implement programs and strategies to improve those priority areas. And as I said earlier on in the presentation, it helps us to recognize that there are factors beyond standard medical care that influence a community's health. So this is the county health rankings take action cycle. So you can see that there are a lot of different aspects of this cycle that go right along with the MAPP framework. And some of those I'll point out. In the center of the model, you see your partners, or what I would refer to as our local public health system partners. And then in the middle of that is your community members, your citizens. So you're going to work together and you're going to communicate with each other to assess needs and resources of your community. So that sounds very familiar to the MAPP framework. Then you're going to choose effective policies and programs based on those needs and resources that you've determined. You're going to act on what's important, so you're going to look at your priorities and you're going to take action on those, and then you're going to evaluate and plan those actions. I understand that this slide seems a little bit busy. However, I feel like that it really helps us understand the county health rankings model and what the county health rankings look at to help us determine where our county ranks on the scales of health outcomes and health factors. So we'll start on the left side of the model. So the left side of the model shows us health outcomes, health factors, and policies and programs. When you look at your county's ranking in the county health rankings system or website, it will give you a ranking for health outcomes and a ranking for health factors. So health outcomes represents how healthy a county is currently or right now. It reflects the physical and mental well-being of residents within a community through measures representing not only the length of life, but the quality of life. So the county health ranking refers to it as not only how long we live, but how well we live. The other area is health factors, which represent those things that we can modify to improve the length and quality of our residents. They are predictors of how healthy our communities can be in the future. And your health factors are broken down into 4 areas there. You can see health behaviors, clinical care, social and economic factors, and physical environment. And we're going to talk about those in just a moment. The explanation for each of those is on the right side of the screen. So then you have policies and programs at the bottom in the reddish orange box. So our policies and programs at all levels, the local, state, and federal levels, all play an important role influencing all of these health factors and then in turn our health outcomes. By implementing strategies that target the specific health challenges of a community, we have an opportunity to influence how long and how well our people live in our community. So when we look on the right side of the page, under health outcomes, like I said, there's how long we live and how well we live. So length of life is, of course, measuring how long people in a community live to tell us whether people are dying too early. And it's going to help us look at what may be driving or influencing any premature deaths that we're seeing. Quality of life refers to how healthy people feel while alive. It represents the well-being of a community and underscores the importance of physical, mental, social, and emotional health all the way from birth to adulthood. So those are the 2 areas within health outcomes rankings. Within health factors rankings, the first at the top is health behaviors. There are actions individuals take that affect their health. It's things that can lead to improved health, and actions that increase risk of disease. So tobacco use, diet and exercise, alcohol and drug use, and sexual activity are all four of the major areas that are looked at within the health behaviors category. Clinical care is access to affordable, quality, and timely health care so that you can help prevent diseases and detect issues sooner. That will enable our individuals to live longer, healthier lives. So access to care and quality of care are the two areas that are looked at by the county health rankings within clinical care. The third area within health factors is social and economic factors, such as income, education, employment, community safety, family and social support. These all can significantly affect how well and how long we live. They affect our ability to make healthy choices. They affect our ability to be able to afford medical care and housing, helps us to better manage stress, and lots of more things that can impact our overall health and well-being. And last, but definitely not least, is physical environment. This is where our individuals live, learn, work, and play. People interact with their physical environment through the air that they breathe, the water that they drink, their houses that they live in, any transportation that they may access to go to work or to school. A poor physical environment can affect our ability and that of our families and neighbors to live long, healthy lives. The two areas that are looked at within physical environment are air and water quality and housing and transit. So all of these areas on the right side of the image or graphic, all of the data that are compiled from these areas give us the ranking for our community in health outcomes and health factors. So this is an overview of Laurel County's county health rankings over the past 4 years. So I circled 2018 because that was the year we did our last community health assessment. So like I said, we get a ranking in health outcomes and in health factors. So you can see in 2018 when we conducted our last community health assessment, Laurel County ranked 63rd in the state of Kentucky for health outcomes. And if you remember, health outcomes is how long we live and how well we live. There's 120 counties in Kentucky, and over half of those rank better than us. Then you look at health factors. So like I said, health factors are those things like health behaviors, clinical care, physical environment, family and social support. We ranked 79th out of 120 counties in 2018. In 2019, our ranking for health factors worsened to 83rd, but we stayed the same in health outcomes. Then in 2020, we improved in health outcomes to 60th, and we improved in health factors to 79th. We know what happened in 2020. That's when the pandemic hit. The 2021 rankings don't have a lot of information about the impact of COVID-19 on the community. County Health Rankings has said that hopefully the 2022 health rankings will help better give a snapshot of what the impact was in our community related to the COVID-19 pandemic. So in 2021, these were released in April of 2021. And we, for health outcomes, Laurel County ranked 61st, and for health factors, we ranked 75th. So we're hovering very close to the same for health outcomes over the past 4 years. Our health factors have improved. So I'm anxious to see what the 2022 health rankings for Laurel County show, which hopefully will be released in the spring of this year. So seeing the results of the health rankings and where Laurel County falls out of all of the counties in the state of Kentucky for health factors and health outcomes is a motivator for us to work collaboratively to improve the health of Laurel County. So this is just a map of the 2021 health outcomes for Kentucky. So the darker the color, the lower the ranking. And when I say lower the ranking, it's actually the higher number. So the worse off that county is. So this is something that you want to be number one in, is your health outcomes. That tells us that the community has a longer life expectancy and their quality of life is better. So the light colors here are the higher ranking counties. So those are the counties that are doing the best. And then you have a light green here. That's the counties that are in the next category. And then you have a little bit darker green, which is where we fall here at Laurel County. And then your dark green counties are those that are at the end of the rankings. They are the lower for life expectancy and quality of life. And you can see the majority of the dark green counties are over in the eastern part of the state for health outcomes. So then with health factors, which are those things that we hopefully can influence and change to help improve health outcomes, you can see Laurel County here is in not the darkest blue, but the kind of what I would refer to as a baby blue color. So you can see again the first 30 counties, which are, like I said, the best, are here with health factors. Then you have the next 30 counties are the little bit darker blue. And then those counties that are ranking anywhere between the 61st to 90th are in the next darker color. And then the ones that are in the 91 to 120th spots are the dark ones, which again, you can see the majority of those are in the eastern part of the state. So that was a brief overview of the county health rankings and why we use those and why they're a beneficial tool for the coalition as it completes a community health assessment process. So now we're going to talk a little bit about the 4 assessments within the MAPP process. Those you can see here on the screen: the Community Health Status Assessment, Community Themes and Strengths Assessment, Forces of Change Assessment, and Local Public Health System Assessment. The Community Health Status Assessment is an assessment where we look at key health indicators and existing data that has already been collected by other organizations, such as the Foundation for a Healthy Kentucky, the United States Census, County Health Rankings, and the Youth Behavioral Risk Factor Surveillance System, and any other important data sources that can give us a good feel for the health indicators within our community. And we mentioned that we can include a focus on health equity with this assessment. And one of the things that we can do is do some cross tabulations that measure health disparities. We can use these to identify differences in health status among different groups. For example, if we used data on cardiovascular disease preference, we can also collect data on race and gender and then do some cross tabulations to see if there are differences in the prevalence of cardiovascular disease based on race and gender. The Community Themes and Strengths Assessment, or what we have affectionately referred to as our community survey, helps us to solicit the attitudes and opinions of citizens on health issues in the community. The methods that can be used for this is a community survey, community forums or town hall meetings, focus groups, and key informant interviews. These methods can be used in any combination. And as far as the community survey goes, in the past we have done both an electronic version of the survey as well as a paper copy of the survey so that we can get different populations input. We often have partnered with local agencies to distribute this survey or to help facilitate the forums, meetings, and focus groups. We have set up at places in the community to help solicit citizen input. How can we incorporate health equity in this survey assessment. This can be used to collect information about how community members experience the effects of health inequities. The assessment can be designed to investigate what in your community currently and historically has contributed to health inequities identified in that community health status assessment that we've already talked about. There are some questions that the MAPP framework provides to help guide the conversation and engage our community members about root causes of health inequities. And they do recommend that you make sure to include individuals who have been affected by inequity in any of the conversations that we have. The Forces of Change assessment identifies all forces and associated opportunities and threats that can affect the community and local public health system either now or in the future. These forces can be trends, factors, or events. Trends are patterns over time, such as migration in and out of a community or growing disillusionment with the government. Factors are discrete elements, such as the community's large ethnic population, an urban setting, or the jurisdiction's proximity to a major waterway. Events are one-time occurrences, such as a hospital closure, a natural disaster, or the passage of new legislation. So when we're looking at these factors, we want to consider different categories and make sure that these are included. So some categories that we will look at in relation to the forces that can be trends, factors, or events are social, economic, political, technological, environmental, scientific, legal, and ethical factors. Typically in the past, we have completed this assessment as small group work within the coalition. We can continue to do the assessment this way in 2022, or as a coalition we can discuss another way of approaching this assessment. The local public health system assessment is based on the 10 essential public health services and evaluates or ranks how well the local public health system as a whole is performing the essential services within Laurel County. The instrument that is used to conduct this assessment is the National Public Health Performance Standards Program tool. This instrument describes what the local public health system would look like if all the organizations, groups, and individuals in the community worked together to ensure that essential services were delivered optimally. The descriptions of what should occur in the community serve as model standards of local public health system performance. The community representatives and local public health system partners who are a part of this assessment participate in facilitated discussions to determine how well their local public health system achieves the model standards. So the tool is broken down into chapters that each correspond with the 10 essential public health services. Then each chapter has a series of model standards and questions that are used to guide the facilitated discussion. And answers to those questions serve as measures of local public health system performance. Once the assessment is completed, then we report that to the CDC, and they generate a report for the coalition that lists the strengths and opportunities for growth for our local public health system. This is another area where we can ensure that we are assessing and acknowledging health inequities. During the facilitated discussion, questions can be framed to identify how well our local public health system is acknowledging and addressing these health inequities. And the handbook for MAPP actually provides you with some examples of how those questions can be reframed to reflect assessing health inequities. So this assessment has been the most challenging assessment for us to conduct over the 10 to 12 years that we've been doing this. It is a very lengthy assessment. It does require our partners to devote time away from their regular jobs to complete this. which can be a challenge, especially in the times that we're in right now with the workforce being strained as it is due to the pandemic. So we're looking at ways that we can conduct this assessment or something very similar that doesn't require us to pull our partners away from their regular job duties for such a lengthy period of time. This has been done successfully by other agencies within Kentucky and the United States. So this is something that we can discuss as a coalition as we move forward during 2022 in preparing for completing the local public health system assessment. So I wanted to bring the 10 Essential Public Health Services graphic back up, since the local public health system assessment is based around this. We want to ensure that when we're looking at the people that are participating in this assessment, that we're pulling all of the local public health system in, especially those who in some way carry out these 10 services. Public health, the local health department, is involved in each of these services to some degree. But we also have agencies within the community and within the local public health system that might focus on one of these services. And we want to ensure that we have that person at the table when we're working on this assessment. So once we have completed the 4 assessments of the MAPP framework, what then? Well, we want to make sure that we have the results of those assessments analyzed and make those available to our coalition members. Then we will convene to identify our coalition strategic issues or our community health priorities. We will utilize all 4 of those assessments to look at different areas of our community and decide where we need to take action. Each of those assessments will give us different information to help us move forward. The Community Health Status Assessment, which is the assessment where we pull secondary data that's already out there and exists, will tell us what health conditions exist in our community at this time. The Community Themes and Strengths Assessment, which is our survey, focus groups, key informant interviews, actually will tell us why do health conditions exist and what assets are available in the community, as well as what is the quality of life within our community. The local public health system assessment will help us see what system weaknesses must be improved and what strengths of the system can be used. Also, it will help us to see what short-term or long-term systems performance opportunities are already there. The Forces of Change assessment will help us see what forces are affecting how we need to take action on these health priorities. So once we've identified those community health priorities, those will become part of our CHIP or Community Health Improvement Plan. We will then formulate goals and strategies to help meet those identified issues. Then the CHIP will be moved into the action cycle. We will take action and actually implement those identified goals and strategies to improve those health priorities, and we will evaluate those as the coalition sees fit. Most evaluation takes place either every 6 months or annually. We will review that evaluation and determine if we need to make changes with our goals and strategies moving into the next year of the CHIP cycle. So many times when we invite someone to be a part of this process and to be a part of this coalition, they want to know what's in it for me and what's in it for my agency. Well, it's a great public relations tool. It's going to provide useful and practical guidance for helping our community prioritize public health issues and identify resources for addressing them. It's a wonderful accreditation tool for any organization. The health department is a nationally accredited public health department, and we use this information and this process as part of our documentation for our accreditation. This coalition and this process creates a sustained community initiative that ultimately leads to community health improvement. it's also a means to gain respect in our community. And it provides us with a sense of accomplishment by bringing a variety of players to the table to work for the improvement of our community. Thank you for taking time out of your busy schedule to view this presentation. We hope you found it beneficial as a current or potential coalition member. A printable copy of the presentation slides is available on the Laurel County Health in Motion webpage, which is located within the Laurel County Health Department website. Please also complete the evaluation and questionnaire provided at the link on this slide. This will give us feedback on how we can improve this presentation in the future. The link for this evaluation may also be found on the Health in Motion Coalition webpage. We also have a Health in Motion Coalition membership form that we would like for each organization that is a member of the coalition to complete. Tell us how involved your organization can be with the coalition and the assessment process, and you can return the signed membership form to me, Brandy Gilley, the coalition facilitator. Do you have questions or comments? Please reach out to me at the Laurel County Health Department. You can reach me by phone at 606-864-5187 or by email at brandyn.gilley@ky.gov. Again, I thank you for your time.